Hello, hello, hello. This is Dr. Jenkins, and we're going to quickly just finish this chapter on fats. There's only going to be a couple things you need to know from the end of this chapter, but I want to make sure I recorded a video so you knew exactly what you needed to know. There will be quite a bit of extra information that might be interesting, but will not be on a test. Okay, so here we go. I introduced this at the end of lecture on Friday. And I just want to make sure that you can define ketone. So remember, a ketone is a chemical that is produced naturally as a byproduct of fat metabolism. I reviewed this on Friday. We talked about a natural byproduct of burning carbs for energy. The natural byproduct of burning carbs for energy is lactic acid. Even if you don't necessarily understand what these words mean, simple understanding of it's a chemical that's produced during something. So lactic acid is produced during carbohydrate metabolism, which is just another way of saying it's produced when we burn carbs for energy. Anytime your muscles burn carbohydrates for energy, they produce some lactic acid. It's normal, right? So the key thing here is lactic acid is naturally produced during carbohydrate metabolism. Now we're introducing a different chemical called ketones. You just need to be able to pair ketones with fat metabolism. Anytime we burn fat for energy, we naturally produce ketones. For both of these, they're okay in small to moderate amounts. We naturally produce some lactic acid. We naturally produce some ketones. However, both of them can be a problem in high amounts. In high amounts, if we produce more than we can get rid of, they can lead to making the blood acidic. Okay, as an aside, this is something you don't need to know, but you may hear ketones. Ketones themselves in some ways, in some times, can be used as energy by the body. So that is true. I don't know if it can be used very often. We're going to talk about the supplementation more in a bit, but it's true. In some ways, at some times, the body cells can use ketones for energy. But you don't need to know that. All right. We're going to talk more about these ketone supplements later. This is a newer supplement. You may not be surprised to show that ketone supplements thus far have not been shown to be effective in scientific research. I apologize for these circles, and whenever I bring these things over from PowerPoint to my iPad, they bring, so just please ignore. You don't need to know these supplements for now. All you need to know for now is ketones are produced when we burn fat for energy, okay? Now, there is something called the keto diet. I do want to talk a little bit about this that you will need to know. You've probably heard this, at least you're probably somewhat familiar with it. A keto diet is another way of saying high fat, low carb. So in many ways, it's not that different from a low carb diet. The keto diet is designed to make you burn more fat. If I don't have as many carbohydrates as usual, the thinking is, then you'll more quickly turn to fat. And as we talked about, wouldn't your cells like to burn fat? Yes, your cells would like to burn fat because they give us more energy per gram. What does the research show? In some people, it does make you burn more fat, but it doesn't necessarily improve performance. So hear me out here. When we do studies with this, we purposely put athletes on this diet. And by the way, What kind of athlete would benefit from this? Potentially, an athlete that's going to burn more fat. Not a sprinter, not a football player, not a weightlifter. Who's going to burn more fat? A more endurance athlete, marathon runners. When you put some marathon runners on this diet and we do blood tests, it does show, the blood shows in many instances that they're burning more fat, but it doesn't carry over to performance, does not improve performance. And that's because we still need carbs. You can't just take away a complete fuel source and expect the body to improve its performance. So on its face, if you just think about the theory, it could make sense. But when we run the studies, while it may show with their blood tests that you are burning more fat, it doesn't seem to actually be improving performance. Something else interesting to note, when you're on this diet and you're lowering carbohydrates, that means that when you're training, when you're doing your practice and your training, you can't exercise as hard. If I'm limiting my fuel in my training, I'm not exercising, I'm not training as hard. So how can I be expected to improve my overall performance when I'm not training as hard? As an aside, if somebody was to try this diet, I would almost always recommend it only be men. And that's because this diet is not effective really at all. When we run the studies, it can show more fat burning in men, but not necessarily women. Because women have a different hormone profile, particularly estrogen, estrogen actually makes women better, more efficient at burning fat. So women, like myself, we're already burning as much fat as we can in most instances. So trying to adapt the diet to make me burn even more, there's just no more room to become any more efficient. You don't need to know that about women. That's just extra. You just need to know that this diet includes higher fat, lower carb diet. The goal is to make you burn more fat. If I burn more fat, I can get more energy, is the theory. In some people, particularly men, it does actually show with blood work that they're burning more fat. But that doesn't seem to carry over to performance. All right, good work, everybody. We're going to talk about these other ergogenic aids or supplements later. I just want to remind you, this is something I said earlier. I talked about carnitine. Again, sometimes you don't even have to know what these chemicals, the chemical structure, you don't need to know that. We just need to associate carnitine with burning fat. So when we come back to our supplement chapter later this semester and I say carnitine, I would like you to be able to remember, oh, okay, carnitine, something related to burning fat. And that's going to clue me in to how the supplement might work. In other words, could help endurance athletes, not strength. We're going to talk more about some of these other ergogenic aids also later. You don't need to know them now, just later. Again, please ignore these circles. It's a formatting glitch. I just want to say, you don't have to know this for an upcoming test or anything. I just want to say there's many supplements and ergogenic aids that also are trying to alter our fat metabolism. So everyone knows about caffeine, in addition to supposedly making us have more focus. One of the reasons why endurance athletes will have a little caffeine is because it helps us burn more fat, mobilize more fatty acids. So we'll talk about that later. We'll talk about pyruvate. You don't need to know these now. There are other types of diet plans with the goal to increase fat oxidation, which just means to burn more fat. Fasting. I think this is going to be the last topic for the end of this chapter that I want you to know. Fasting is another diet technique with the goal burning more fats. So what is the goal? to burn more fat. Remember, if given the choice, what would your muscles rather burn? Fat. So we talked about the ketogenic diet, from day to day having a lower carb, high fat diet. Without as many carbs in the diet, maybe I can force the body to burn more fat. For the ketogenic diet, while it may show that we're burning more fat in blood tests, it doesn't seem to improve performance, especially not in women. Well, another diet technique aimed at burning more fats, because that's what we want to do really to get the most energy per gram, is fasting. There's all sorts of ways people fast. It's much more popular now than it used to be. It can be a 12-hour fast, a 24-hour fast, a 36-hour fast. The goal is to burn more fats, even at rest and during exercise. What are some of the negatives? Well, it could make you tired because you're not bringing in nutrients. It actually can lower performance because it's same as before. You don't have as many carbohydrates. Similar to the ketogenic diet, not recommended for women. The hormonal profile of women makes this not as effective. If it were to be effective, much more likely in men than women. Nowadays, if you do a little bit of research on fasting, some male athletes love it, particularly endurance. Some male endurance athletes say that it really is effective. If somebody was to consider this, what I would recommend would be men. Not really going to be effective at all in women. So I would only recommend, if somebody was interested, go ahead and try it, but I would only say to try it if you were a male. Because for women, we are not going to, almost certainly, we're not going to benefit from this. If somebody was going to try this, I would recommend shorter duration. A 12-hour fast. Maybe in the highest I would go is a 36-hour fast. That's it. We don't seem to find that the research has any benefit to longer duration than that. Again, some people really love it, particularly men. You can read about it. I do think it's a very individual thing also. Some bodies, I think, are better adjusted to it than others. Some people, their natural genetics just makes their body not good at it. I think it's a dangerous thing for a young athlete. So I would say for an older athlete, and I don't mean elderly, but I wouldn't say for someone in their teens or early 20s. You're still growing. Your body's still maturing. So doing this could potentially disrupt your overall metabolism. So I'm just going to say 25 years plus. Those are my recommendations. Okay. What you need to know, that a fasting diet is also a technique with the goal to make you burn more fat. If it was going to be effective, it would be more effective in men. If it was going to be effective, I would say a shorter duration fast, not long. You can read through the rest of this. Years and years ago, there was a short-term high-fat diet. This is not so much in vogue anymore. We don't think that it helps. And I mentioned this before. We can do some carbohydrate loading, and that can be effective for some endurance athletes. For fat, though, because it's harder to break down, it just doesn't work as well that way. So this would not be recommended. A long-term high-fat diet, a keto diet, for an athlete, I would say no. So for an athlete to go keto, only men, I think, should try it. And I don't even recommend it because the research doesn't say that it improves performance. But if they were to try it short term, months max. However, for someone who is significantly overweight and not an athlete, to jumpstart a weight loss, the keto diet can absolutely start to lose mass. hopefully fat mass. Is it sustainable in the long term? No, because we need carbs for a reason. But the only time that I could say the research supports a long-term keto diet would be non-athletes looking to jumpstart a weight loss process. And this would not be a long-term solution, but just a short-term solution to get them started. So, ending this chapter, carbohydrates should remain number one. We already know we need those the most. We need a moderate fat diet. We should have mostly healthy fats. There's no significant change to fat before and after, right? Okay. Thanks, folks. Any questions, let me know.